Adam, and this is Simon. Today we're talking about how you can use Dr. K Kinesiology Tape to help with neck and shoulder pain. So neck and shoulder pain is quite common and is often motivated by postural issues, but as well as that can be acute in nature. So you might wake up with a stiff neck in the morning, which we call a wry neck, or it might be an overuse problem that relates to using a computer or driving a car for long periods of time. So the taping can help to try and support normal posture more effectively and promote an unloading and a decompressing of some of the painful areas in necks and shoulders. So for this particular application, we want to position the patient in a relatively flexed position, so chin forwards, slumping slightly so that we're lengthening through the neck and upper back. And so we're going to measure some tape that runs parallel to the spine, so we're going to do a strip either side, and then we can place a horizontal piece across the shoulders as well to help aid that positioning. So we're going to start a piece that sits just sort of middle neck for the most part, and we're going to run down to about the base of your shoulder blade, a bit above, and we're going to cut two pieces that mimic that length, bearing in mind with the measurements that the tape will actually end up longer than the piece we cut as we stretch it to apply it. And then we're going to also measure a piece that runs horizontally across the shoulders there. So before we put the tape on, we're going to cut the corners off to prevent peeling of the tape. And then we're going to prepare the ends of the tape to provide our base pieces. So we're going to start by folding down the end of the tape and then tearing along that fold. Then we can peel back a little tab for ourselves, peel off the tape, and then we've got a piece that we can apply for our base. So in our flex position, we're going to line ourselves up so that we're running a piece either side of our central spine position. As I said, starting about sort of middle part of the neck. We're going to place that piece down, give it a rub to make it stick properly, and we can peel back the length of the tape, and we're going to put about 50% tension, run down the length of the spine there, and then place and then rub again to stick properly. And then we're going to do the same thing on the other side. Tear, fold, place on the other side there, rub to make it stick, peel all the way down, leaving our end piece without tension. And then our horizontal piece, we're going to fold in the middle and tear along that fold and peel back the centre of the tape to expose the adhesive part of it. And we're going to place that piece across the area where we want to unload. So that might be lower down or it might be higher up depending on the circumstance. And we want to try and place it down so that there's no tension across the middle. And then we're going to peel back and put about 75% tension across that tape over the sides, leaving the tail without any tension. And then we're going to repeat that on the other side. We're going to peel back most of the way, making sure that our middle piece again is not tensed. Over we go, 75%, and then the last little bit goes on without any tension. So as with any kinesiology taping application, we want to ensure the tape stays on. So this particular area is prone to coming off when you're dressing or showering particularly. So being careful when you're putting clothes on, you don't peel the edges. Patting dry with a towel rather than rubbing to make sure the tape doesn't peel. And avoiding use of things like moisturisers and creams and oils under the application, and also excessive hair to prevent that from coming off. So when it comes to treating injuries in this area, common therapies include stretching, massage, anti-inflammatories, heat treatments, and they're all going to complement the taping in addressing some of the pain and problems in that region. So for more information, visit sportstrap.com.au.